Hello. Kat, are you on? Hello? Oh, yeah.
Hey, I'm going to call in on the phone instead of the computer. Just give me 1 second.
Hello?
Hi, John. How are you?
Good. I was talking, but you couldn't hear me.
I think you were on mute.
Okay.
We just opened up a little bit early to make sure all the panelists get here and all that good stuff.
Right. I just thought I'd call in early in case you needed me for anything.
That's great. I appreciate it.
So my executive
I'm actually
director.
I'm gonna promote you to a panelist.
Ooh, do I get a raise?
Obviously. Let's see if that works. If it doesn't work, then I will okay. There you go. Okay. Are you still there, John?
Yeah, can you hear me?
Yeah, perfect.
I'm very concerned that my Oreos are not gonna make it through my period of sequestration.
We'll send more.
Okay, I'm on. Can you hear me?
Yes, I sure can. That's great.
Excellent. And hi, John.
Hi.
Should I go ahead and share my slide?
Yeah, go for it. I can make sure everything's working.
Woohoo!
Step 1.
All right. Is that working?
Yeah.
In full screen mode?
Mm-hmm.
Great.
Okay. And it's great because then I can do the chat, see the chat, and watch the panelists and all that good stuff.
Is there a delay on the slide progression? So I'm going to click it now.
Nope. It's going smoothly for me.
Yep.
Cool. That's great.
And it's we're recording and all that good stuff. I can edit out the first couple of minutes, so no worries.
Do you know, is this panelist line not available for participants, or can everyone hear us right now?
I think everyone can hear us, so we can just kind of.
Okay. Checking.
Mhm. John, are there any other questions you'd like to see asked besides what I sent around? Or
No, if I think of any, I'll put them in the chat feature.
okay, thank you. Maybe another minute, and then Kat, if you want to send a reminder to the others to join. They all said that they got their thing, but we'll see. I'm actually going to see if I can resend them there. Okay, I just resent their information just in case. For everyone that's joining, we'll be getting started in just a few minutes. We're just waiting for our final speakers.
Okay, I think we're going to go ahead and get started. We are still waiting on a couple of our folks that are going to join us later in the webinar, but I think they're just having some technical issues. So hopefully they will be with us shortly. And it is 11 o'clock and we don't want to waste anyone's time. So we're going to go ahead and dive in. So I just want to thank everyone for joining us. Say good morning, good afternoon, and good evening to folks wherever you are in the world. And my name is Kat Gironda. I'm the Research and Program Manager at Funders Concerned About AIDS. I just want to really thank everyone for being here and say to start that I know this is a particularly challenging time for everyone to be in, and to add this on top of the hard work that I know everyone's doing already. So I just want to acknowledge that. We're really appreciative that folks have lent their time to be on this webinar, and to all of you who are here to listen and participate in these conversations. So FCAA is definitely monitoring everything that's happening in our community and with our members with the coronavirus, and we are sharing updates online and resources, so keep an eye out for that. We'll keep posting those things as they come our way. So just a few logistics to kick us off. We are recording this webinar, so slides will be available afterwards for anyone who wants to reference them or share with their communities, or if you're having any trouble with the visuals, they are up on our website as well, so you can access them there. We do ask that folks mute your lines. We'll do our best on the back end to keep everyone's lines muted, but it is helpful if you can do that on your own end. So if you can mute your phone lines or mute your computers, that would be really helpful so we don't have any background noise. And finally, we are going to do a Q&A at the end of the presentation. So we ask that you hold your questions, but you can chat them in the chat box anytime throughout the presentation, or if you are just dialing in from the phone, you can email them to sarah@fcaa.org, and we will revisit those when all of the presentations are done. So just a quick agenda to see where we're going today. We are going to start out with myself just walking you through some of the latest data from FCAA, looking at our new report, Philanthropic Support to Address HIV and AIDS in 2018. And then we're going to be joined, hopefully, by a couple colleagues from Aidsfonds in the Netherlands and Frontline AIDS. And they're going to do a little of what I call putting data into action. So just having another voice talk about how they utilize FCAA data in their own work. And I think that's going to be a really interesting presentation where they talk a bit about how they're looking at funding for key populations. So please stay tuned for that. That'll be right after we go over the data. Then we'll just have a quick refresh for folks who have submitted data to us in the past, or folks who may not have, on how to submit data through our new grant submission portal. That will just be about a minute, and then we'll close with some words from our Executive Director, John Barnes, thinking about some of the big picture questions that FCAA is considering, and some of the upcoming events that we have. So I'm going to dive right in and walk us through some of this data. I just want to remind folks that what we will be looking at today is data from FCAA's annual report that was just released last month, Philanthropic Support to Address HIV and AIDS. And it's looking at all of the HIV-related philanthropic funding that we were able to track that was dispersed in calendar year 2018. So this year's report tracked just over $651 million in funding. That came from 693 funders and went to about 3,500 grantees in the form of over 7,000 grants. So this indicates a mere 2% rise from last year's total funding tracked. We're calling that just an incremental increase, which almost signals more of a flatlining in the field rather than a notable change. While we are, of course, always pleased to see an increase rather than a decrease, we just note that we're still cautioned that the need is outpacing the funding. And as we see more and more funders move away from the field, and this continued concentration of funding at the top, it gives the field a bit of a precarious nature. We did some preliminary analysis this year that actually suggested that over the course of 6 years, we saw more than 30 of the once leading funders have left the field or significantly reduced their funding, taking with them approximately $130 million. And that's something we're going to look into a little more. But again, just a bit of cautioning despite seeing that slight increase this year. Just to further this point, here you can see in the chart on the left that the top 20 funders accounted for 87% of total funding. That's 20 funders out of 693 that we tracked. So less than 3% of funders are accounting for 87% of total funding. And in that same chart, you can see that the top 2 funders alone accounted for 56% of total funding, that being the Bill and Melinda Gates Foundation and Gilead Sciences. So we're looking at a quite serious concentration at the top. On the right-hand side, you can see the full list of top 20 funders. You may notice that after Bill and Melinda Gates Foundation and Gilead Sciences this year, we're seeing the Wellcome Trust at number 3. They are a research-based funder, a research funder based in the UK, and they have consistently been a part of the top 20, but we are seeing them at number 3 this year. However, they did report that this increase is not necessarily a sign of heightened attention towards HIV, but rather just a fluctuation in response to the nature and type of research grant applications that they received in 2018. So not necessarily something that will be consistent. You can see this full list of top 20 funders in our report, but also the entire list of all 693 funders, their total giving, and how many grants that they gave in the appendix of our report, which I should have mentioned is available online at FCAA.org. So please feel free to download that and check it out. I did mention that we collected data from 693 funders this year. That's actually 250 more than we collected data from last year. So we do acknowledge this change in our report. While it was not necessarily a shift in our methodology, but due to increased data that we were able to gather from Candid, formerly the Foundation Center, now Candid, where we do a final scan of all grants to see if we can capture any funding that we were not able to gather directly from funders. So this does sound promising again, but it's not necessarily a sign of a growing field of funders. To better understand this pool of new funders, we did an analysis to look at how many grants were given by funders in general, and you can see the breakdown here on this table. So this is a new type of analysis for us, but we wanted to really look at how many grants each funder was giving. And you can see that 471 of those 693 funders, so almost 70% of funders, gave 1 grant. Again, we're seeing that concentration of the majority of funding lying with a small pool of funders at the top of the field there. So a little look at where the funding is coming from, and we look at this in a number of different ways. We track funding coming from philanthropic organizations based in 14 different countries in 2018. You can see the countries and the amounts listed on the right-hand side of the slide there. You can also see that the vast majority of funding that we tracked came from the US, accounting for about 80% of total funding. Another way we look at where the funding comes from is where we break down corporate funders and HIV-specific funders in our report. So this year we saw that there were 30 corporate funders out of the 693, but they accounted for 34% of all funding, about $230 million of total funding coming from corporate funders. We broke that down a little more this year and noted that 20% of those 30 corporate funders were pharmaceutical companies, and yet they were responsible for 86% of corporate funding and 29% of HIV funding overall. And even within that pool, we looked at, of all corporate funding, about 82 million, or about 36% of corporate funding, went to continuing medical education or to organizations that assist patients to obtain medication copayments. So just thinking about ways that we can really assess that money and look at it a little closer this year. And you can see more details about that in the report. Another way we think about where the funding is coming from is looking at HIV-specific funders. So of the 693, again, only 26 we identified were HIV-specific funders. And they were responsible for almost a quarter of all HIV-related funding, as you can see on the slide there. On the right-hand side as well, you'll see the list of all of those funders. That's also available in the report if you don't have the slides in front of you. We thought about this a little this year in a different way, considering that 21% are HIV specific and they do pack a big punch, but that also means that about 79% of funding is coming from funders that do not identify as HIV specific funders. And if you were at our summit this year, you know that we are exploring what it means to be an HIV funder and thinking about this question and the increasingly intersectional nature of HIV funding. So it's just something that we wanted to draw attention to, and I think we'll talk a little more about that at the end of the webinar from our Executive Director, John Barnes. So looking at where funding is going, at the highest level, we look at funding distribution through these three categories, global, international, and domestic. Just for clarity, this breakdown is related to the location or headquarters of the funding organization and the location where the specific grant-related work is being done. So not necessarily the location of the grantee, as we track all geographic funding at the location of impact and not the location of the recipient organization. Thus, domestic funding refers to grants where the funder is granting to work in their own country of headquarters. International refers to grants where the funding goes to a country or countries outside of the funder headquarters. And global refers to non-country specific grants that have a global impact or reach. And that's often research-related grants. So funding this year had an almost near even split between global, domestic, and international destinations, as you can see on the chart there. Historically, most funding has been directed globally because of large research grants that benefit a global population. Those are often funded by the Gates Foundation. However, we did see a slight decrease in global funding this year after a decrease as well last year. So these areas of funding are becoming quite even. And the rise in domestic funding that we saw is mostly attributed to funding for the US epidemic, which we have seen steadily climbing each year. And we'll talk a little more about that shortly. Another way that we break down funding destination is by looking at the distribution of funding by country income level. We know that many middle-income countries are transitioning away from donor-funded health programs, and that progress around HIV can be fragile during times of transition. But we also know that the majority of people living with HIV live in middle-income countries. So one of the reasons that we like to break down this funding this way. So in 2018, 29% of country-specific HIV-related philanthropy was dispersed to middle-income countries, and that was an 11% increase from the previous year. And as you can see in the chart on the left, more than half of all country-level funding in 2018 went to high-income countries at $225 million, and that was a 7% increase from the previous year. We did see lower middle-income countries had a 12% drop in funding, and upper middle-income countries saw a 53% increase, from the previous year. So some of that doesn't account for countries that may have shifted their income level, so that might be part of it. But in large part, we are seeing an increase to upper middle income countries and a slight decrease to lower middle income countries. And then low income countries received $69 million, which was a slight increase, 5% from 2017. On the right, you'll see the top 20 recipient countries, with the US significantly ahead with almost $200 million. The next country on the list, South Africa, had nearly $39 million in 2018. And then you see Kenya, Zimbabwe, Malawi, Zambia, Tanzania, Uganda, and Mozambique. And I name those only so you can see the trend. Obviously, the next top 8 countries are all in Eastern and Southern Africa, which is the global region with the second highest level of funding after the United States. with 166 million regionally. And you can see a bit of this as we move to the next slide here. The next highest region is West and Central Africa, which capped out at 45 million, and then West and Central Europe at 23 million and so forth. This spread is in our report as well, and you can find that again on our website. It's hard to see here, but we also list the top 3 funders for each region, the top 3 intended use or strategies funded in each region, and the top 3 target populations for each. So it is an interesting glance at the world and how philanthropic funding for HIV is distributed. So I recommend taking a look at that as well. Next, we can zoom in and look a little closer at where all the funding within the US is going. For the 5th year in a row, HIV-related philanthropic funding to the US reached a new high, totaling nearly 200 million in 2018, and that was about a 7% increase from 2017. So you can see on the left the top 10 states, with California and New York at the top, which is quite typical. However, we do see out of the remaining 8 states that 7 of them are located in the US South. If we look at the map on the right-hand side, you can see the regional breakdown of funding within the US. These totals include state-specific funding as well as non-state specific funding that is directed regionally. And you can see that just over 50% of all funding to the US is non-state or region-specific national grants. And those can be in the form of continuing medical education courses that are non-region specific, or national advocacy campaigns, or even general operating grants for organizations that work nationally. And those grants totaled 103 million in 2018. After seeing a significant increase of 67% last year, the US South was actually the only region to decrease in 2018 with a $7.4 million drop. However, while support for the US South did decrease, it still tops the other US regions in funding by over 15 million, totaling 40.3 million in 2018. So that is significant given the level of impact of the epidemic in the South. And we've seen those numbers steadily climbing over the past few years. All other regions in the US did see slight to significant increases this year. The Northeast saw a jump up of 40% to $20 million, and the West increased 55% to almost $24 million. So look a little bit at the strategies used within this funding. FCAA uses 10 different categories to classify the intended use, what we call the intended use of HIV/AIDS grants, or the strategy. Research is traditionally the highest category each year and totaled 235 million in 2018. That was a 12% increase from 2017. Prevention was the second funded strategy, as you can see there, at 160 million, and treatment close behind at 154 million, followed by advocacy at 122 million, and so forth, as you can see on the slide. One feature we did add to this year's report are some callouts on best practices that we culled from a 2018 report that we produced called Last Mile Funding, that looked at research on best practices for funding strategies for community-based organizations. And so we pulled some of those best practices out of the report and did some highlights in this year's report looking at what the funding levels were for some of those best practices. And we did see some progress on some of those strategies this year. Funding for core operating or general operating support totaled 50 million. Funding for advocacy totaled 122 million. That's a 6% increase from 2017. We saw funding for capacity building and leadership development increase 38% this year, up to 63 million. We also looked at funding for grants that included access to PrEP in some capacity, totaling 36 million in 2018, and that was a 16% increase from the previous year. So we do encourage you to take a look at some of those best practice callouts throughout the report. Oftentimes we also include alongside the totals the top 5 funders of those categories, and sometimes as well we'll look at some trends over time if we have the data available to see how the funding has changed in the last 4 or 5 years. So So look for those call outs in the report as well, and they're typically highlighted in that box as you see there. I want to talk a little bit about who the funding is reaching. This is another way that we look at the funding. In our report, we offer a breakdown of funding to various populations so we can understand who's being targeted. And as is typical, funding for a general population, including medical research for general population, was the top funded category in 2018. This is, of course, directly related to research being the top funded strategy, but this population is also associated with large-scale prevention and advocacy campaigns as well. People living with HIV, where there's no specific subpopulation mentioned, was the #2 recipient population, and then followed by youth, women and girls, and healthcare workers, and so forth, as you can see there. Some of the notable changes that we saw this year, we saw funding for older adults increase from $3 million to $22 million. That's a 627% increase for 2018. This was most likely due to a significant new funding initiative called HIV/AIDS Positively from Gilead Sciences, but this increase is quite significant as it is anticipated that 3 out of 4 people who are living with HIV will be over the age of 50 by the year 2030. So quite a positive to see a jump in funding for that community. We also always focus on funding for key populations to better understand if some of the groups most heavily affected by HIV are receiving funding comparable to their need. This year, just to call out one population, we saw $21 million in funding for transgender communities who are 49 times more at risk of living with HIV compared to the general population. This only amounts to 3% of total funding for HIV and AIDS. This year, we are going to do a deep dive to look closer at that pool of funding for trans communities, and we do plan to release an updated infographic on those numbers in the fall, and hopefully that will be alongside some additional programming if health concerns allow us to have in-person programming. Overall funding for key populations reached $119 million in 2018, which is a 7% decrease from 2017 funding levels. And I just want to call out funding for key populations, of course, because our next speakers hopefully are going to talk about how they are using data in their own work that's specifically looking at funding for key populations. So while FCAA is only able to look at that funding through the lens of philanthropic funding, there's very little data that examines how these populations are being reached through public funding dollars, which, as we know, is the vast majority of funding for HIV and AIDS. So it will be exciting to have that look. And that brings me to my final slide. I just want to give a little funding context here, since we've looked at all of this private philanthropic funding. The larger scheme of public funding, as you can see here, shows that we are only 2% of total funding for HIV and AIDS globally, so, or in low and middle income countries, excuse me. So that's a really important message that we highlight every year, but it helps us to think about how philanthropic funding can be used most strategically. And as we always emphasize, funding for advocacy to mobilize more public dollars and more political will is really valuable. And of course, funding for specific populations, often those that are criminalized, like LGBTQ folks, like people who inject drugs and sex workers, that are often not reached by public funding. So just a little context, and I think that's a really good place to leave us. I'm really looking forward to hearing a little more about Aidsfonds' upcoming desk study that's going to examine how public and private funding dollars break down for key populations. And I think that they are on the line now, so that's a really good sign, and we get to hear a little about how they are using FCAA's data for their work moving forward. I do want to just pause and say, if you have questions, please type them into the chat box, and we will get to them before we close out for sure. I'm really grateful to Arben Fatai and Kana Dharmaraja from Aidsfonds and Frontline AIDS for being with us and sharing a little bit about their project and the work. And I'm going to go ahead and pass the mic over to them if we can get them unmuted and ready to go. Arben, are you on the line?
Arben is. I'm just working on getting him unmuted.
Excellent.
Okay.
Hi,
Arvin, I
can you
think
hear
you're
me?
ready. Yes, we sure can.
Yeah, sorry, I was connected from my phone because we have electricity cuts in Belgium and the Wi-Fi is not super reliable, obviously. So I was trying to speak from my phone. Obviously, it didn't work. So let's hope there are no more cuts and I can go through my points here. That being the case, I'll try to reconnect by phone, but normally I'm in.
Uh-oh, did we lose him?
Can you hear me?
Oh,
Yes,
yeah.
we got you.
Can you hear me? Yeah.
Yes,
Okay.
we can hear you.
I was saying, thanks for the opportunity. My name is Address HIV. I'm based in Brussels, heading the EU office of Aidsfonds, and I'm part of the international department of the organization. So today I've been asked to talk about the research that we are currently finalizing, and which is provisionally titled Off Track, How Global Investments in HIV Programming for Key Populations are Falling Short. So the title might change as we are currently, in the process of finalizing the research and validating the data. And I'll speak more about all that a bit later in my intervention. I want to point out that today, unfortunately, we cannot yet share the concrete data, but I will try to give a general sense of the research and how we have collaborated with FCAA in collecting those data, and then what the plans are moving forward in terms of disseminating the research and facilitating its uptake for advocacy by community-based and key populations networks. So maybe a few words regarding Aidsfonds and the different programs that are funding this research. Most of you on the call will know Aidsfonds. For those who don't, I just wanted to say that we are both an expertise center and a foundation working both in the Netherlands and abroad, and involved in prevention, treatment, care, and support for people living with HIV for more than 30 years. We manage a number of large multi-country programs that focus on people who use drugs, LGBT people, and sex workers mostly among key populations. But we also have programs targeting youth, children, as well as women and girls. The two programs that are funding this research are called the Partnership to Inspire, Transform, and Connect the HIV Response, also known as PITCH, and I know many on the call will know the PITCH program, while the other one is Bridging the Gaps. And again, I know there are a number of Bridging the Gaps partners in this call. Both those programs are funded by the Dutch Ministry of Foreign Affairs. So the PITCH program is a strategic partnership between Aidsfonds, Frontline AIDS, represented here by Kana on the call, and the Dutch Ministry of Foreign Affairs. It's working until the end of this year. We are in the final year. It was a 5-year program working in 9 countries to support local organizations that work with key populations and adults and girls and young women to advocate, generate evidence with an aim to improve policy in the HIV/AIDS response. Whereas Bridging the Gaps is a bigger partnership of 9 international organizations and more than 80 local and regional organizations in 15 countries across 3 regions of the world. It is focused, again, on key populations, obviously, linking human rights and health, and linking key populations and their organizations to each other. It has a big focus on advocacy, but also on treatment when it comes to prevention, treatment, to services, when it comes to prevention, treatment, and care, and advancing human rights more broadly. And most of you will also know that Aidsfonds is a fund management agency for the Robert Carr Fund, with whom we have obviously also worked when it comes to collecting those data. And the Robert Carr Fund is a pooled funding, basically supporting key populations, organizations, mostly with co-funding to implement their mandate. So how did this research come about and how FCAA has contributed? I think our starting point is that although we know that more than half of new HIV infections globally in the last few years are among key populations, effective responses for and led by key populations are usually completely under-resourced, especially when it comes to advocacy, as Katerina was pointing. We, of course, all know that more resources for key populations HIV programming are needed. So we wanted to take this step through this research to try and understand the extent to which such work is under-resourced and where the funding, but also the data gaps exist. So Pitch and Bridging the Gaps contracted Dave Scammell from Communities for Change Consultancies to work with us to analyze the existing databases and try to establish to our best the funding levels for key populations from the major funders in the global HIV/AIDS response. That includes obviously government funding in lower and middle income countries, PEPFAR, the Global Fund, other donor governments, as well as private philanthropy, obviously. So this way we want to understand basically where the funding for key populations at the global, regional and country levels is coming from and where funding and data gaps exist. The research is focusing on HIV programming for men who have sex with men, trans people, sex workers and people who inject drugs in the years 2016 to 2018. Obviously, 2018 is the most recent year where such data are available from all funders. And we thought a 3-year analysis would give us an opportunity to account for trends and year-on-year fluctuations in funding. When it comes to the criteria for the inclusion of data, we took expenditure through grants or programs that were either primarily targeting one or more of the key populations or substantially targeting one or more key populations, but where the percentage of resources going to the key populations can actually accurately be established. So the study focuses on all interventions addressing HIV that are, as I was saying, targeting the key populations. However, I must note that there were discrepancies in what types of interventions were included in the data analyzed by funder source. For example, publicly available PEPFAR expenditure provides detailed information on the full range of funded interventions that are disaggregated by beneficiary, including all 4 key populations. But when it comes to the Global Fund, we saw that they were only able to provide data disaggregated by key populations for only their funding on comprehensive prevention programs. So when it comes to FCAA, obviously, I mean, we saw from the presentations by Katerina that FCAA has been doing great work in tracking philanthropic support for HIV/AIDS for quite some time. We engaged FCAA quite early in the research and requested support in assessing philanthropic support for key population programming in low and middle income countries. We received data that was aggregate and taken from the 2016, 17 and 2018 tracking reports, which gave us the philanthropic support for the 4 key populations broken down by country, as well as multi-country and regions, where grants, for grants that were beyond one country. So I think this level of information was extremely helpful to the consultant that was collating all the data. It was, according to him and what we have seen ourselves, very well organized and transparent. And I think it can easily be qualified as best practice actually to be followed by others. When it comes to future plans for launching and disseminating the research, as I was saying, we are currently in the final stages of completing it. We hope that we will be ready as soon as possible with this research, which is really the first ever picture of total funding for key populations at the global level, including also analysis at the regional level and by the type of funder for each key population. We will aim to provide a series of recommendations to each of the funders about how they can scale up funding for key populations to address HIV/AIDS, as well as analysis, and this is quite important too, on the data gaps that exist and that should be addressed. Importantly enough, I think I'd like to highlight also that the report will also include a focus on the importance of funding key populations-led interventions and advocacy. So for the moment, we are busy putting in place a community advisory panel representing the key populations and their organizations that will be working with the different networks to ensure that the findings from the research are accurate as much as possible and reflect the views of key populations and their networks, and that can be utilized by networks in their advocacy for increased resources for key populations. I think, I mean, as we all know, with development currently around the coronavirus pandemic, it's not easy to plan. Lots of events are being cancelled. Our ambition is to launch the report at the 2020 conference in Mexico, as well as the AIDS conference in San Francisco in July. Let's see how things evolve in relation to that. In addition, we are thinking of organizing an event in Geneva to bring together the main global health agencies and the global health initiatives with UN member states missions there to discuss the findings and the recommendations. And finally, we'll obviously also like to look at the Global Fund as a specific initiative, and one of the biggest, to basically feed the ongoing discussions around the new strategy of the Global Fund, looking at key moments such as the partnership for committees and board meetings that are upcoming. If events continue being cancelled, however, we'll need to reconsider our timeline potentially, but also the way we are planning to launch and disseminate the report, looking as alternatives, to the kind of meeting we are having now, webinars and online events to disseminate the resources. So for now, I'd like to stop here. And again, apologizing for not being able at this stage to provide concrete data, but we don't want to preempt that before we have had a chance to have that community advisory panel to review and validate and work with us in making this resource as best as it can be. Thank you.
Thank you so much, Arben. That's really exciting to hear about, and we're definitely looking forward to FCAA to seeing the final product and thinking about how we can partner and support the launch on that. And I do hope that things are able to move forward, but understand that we have to be conscious of health-related cancellations, which may be forthcoming. But thank you. It's really exciting, and I think a really good example of one way that our data can be integrated into something much larger and contribute to a really great end product. So I really appreciate you coming and sharing. I do think that I'm sure folks have questions and want to hear a little more about that, and we are going to get to it. I'm just going to do a quick refresh on how to submit data for folks who are new to submitting, and for folks who have done it before but have not used our grant submission portal, which we just launched last year. I just want to be sure that everyone is familiar. So this will just take a minute and then we'll move forward. But we have launched our grant submission portal, and last year we had about 50% uptake from funders submitting through here, and it was really, really exciting. And for us, it's going to streamline the process a lot. It's going to help keep the data more secure, help us track better who's submitting, and connect all of that information in the back end to those member accounts. So it's a really big advance for us, and I really hope that folks who weren't able to try it out last year will consider doing so. I'm just gonna click on this little recorded video, which just shows you how simple it is, and I'll kind of talk you through it. So you go to our website, which is posted in our call for data. You click submit data, it'll take you down here and you can download the template very easily. You fill out that template and there's very clear directions in our call for data. If you come back and it's your first time, you go to the activate your account link there, and then you just put in your email address, click the CAPTCHA, and then it will email you a password and a link, and you just log back in and activate your account through that. If you already have an account, you just log in right there. You put your information, click the login button. It's going to bring you again to the Submit Grant Data button and back to step 2, where you can click Submit Grant Data, and then here's our grant submission form. There's some details at the top. Your organization and the year should auto-populate. We really appreciate if you could answer some of these questions. It's really helpful for us, but there's only about 5 of them. Then you can just upload the file from your computer, the grant template, and then click Submit, and it will come directly to us, and you'll receive a confirmation email that it was submitted. So this is really useful, and hopefully folks will try it out. I'm always available via email to troubleshoot, but I think last year, as I said, we had about 50% of members utilize it last year, and I think we only had 2 folks who had challenges along the way. So it's pretty simple and comprehensive, and I really encourage you to try it out and reach out to me if you have any challenges. You keep an eye out for our call for data, which is going to launch in early April, and there will be very detailed instructions about all of this, about why to submit data, about what we're looking for in that template, and very detailed instructions about you know, how to be most transparent in submitting, and make sure that our data is as clear as possible, and then how to go to the website and submit that sheet. So that's all the time that I'm going to take up. I want to make sure that we have time left to hear from our Executive Director, John Barnes, who's just going to talk a little bit about some big picture questions that FCAA has been thinking about, and some of the stuff coming forward, and then we'll move into a Q&A. So John, if we can go ahead and get you unmuted, and then you can hop on.
Great. Thanks everyone for joining us. As Kat said, we recognize that it's a really stressful time, and we appreciate your giving us some of your time and attention today. I just wanted to kind of circle back to some of the things that Kat mentioned earlier.
John, I think you're breaking up a little bit on the line. I'm not sure if we have a good connection there with John.
Yeah, maybe I'll jump in, and John, if you can join us, feel free to take over. This is Sarah Hamilton with FCAA. What we put this slide up here just to be, as Kat mentioned at the beginning of the webinar, that, you know, last year we started kind of asking this question: what does it mean to be an HIV funder? Because we know sort of that conversation is becoming increasingly complicated over time, just based on sort of, if you're looking at sort of the broader dimensions around the epidemic, or if you're looking at it from a kind of an HIV specific lens. And even with our programming, but also with our data, we're really like trying to figure out, so how do we have that conversation? Because with data, of course, it's a very, sometimes it can be a black and white conversation, and we're trying to evaluate that. But we are really committed to you know, working at these intersections and thinking about how we work in partnership with organizations like the Human Rights Funder Network, with Funders for LGBTQ Issues, with Global Philanthropy Project, et cetera, Grantmakers and Aging, to really try and figure out how we inform these conversations and bring funders together. And also, I think it's important to note that we are at the end of our current strategic plan, 2016 to 2020, and it was the first one that we really took a look at sort of the social drivers of the epidemic. And we know for this next one that we're currently starting our strategic planning process for, that we'll need to go further in that conversation. And we really hope that all of you may be partners in that conversation and those that kind of exploration as we move forward with it, because we will be calling on sort of our members and our board and our stakeholders to really help us through with that process. Just for sake of time, I won't go too much further, but just know that we are really thinking about this. There's also a series of interviews that we've been doing with funders on our blog that you can find, where we kind of ask them to really kind of tackle that question for us. And we'll be releasing a few more in the coming months as well. So with that, Kat, I will pass it back to you, and then we can maybe get to Q&A.
Okay, definitely. Thank you, Sarah, and sorry, John, that we couldn't hear you, but if you do come back on the line, hopefully we can have you for Q&A. So just a few things that we have coming up. As I mentioned, our call for data is going to launch in April, so keep an eye out for that. Keep an eye out also for our spring membership drive that will go out in April as well. In May, we're going to launch our call for sessions for our AIDS Philanthropy Summit, and we would love to have folks submit for that. Obviously, everything is pending, you know, that we're allowed to move forward with in-person convenings, and we've already had to cancel a number, and I know folks are all on the same boat. So, so this is, you know, assuming that these things will move forward. We did submit a session for HIV 2020 in Mexico City that's pending. If that moves forward, then look for us there. And we also will be having a funder reception at AIDS 2020 in San Francisco on July 7th, if everything works out. In July as well, we're going to launch some new data that's going to look at the impact of the global gag rule on grantees of philanthropic organizations. So we can really look at who's being gagged and how philanthropic funding is being impacted by the global gag rule. So we're working with AMFAR on that and really excited about how that's going to be able to shed light on philanthropic funding and the influence of global gag rule on that. In August, our data collection will end. So please be sure to get your data in by then. And then we're planning our AIDS Philanthropy Summit for November 16th and 17th in Washington, D.C. this year. So hopefully we will be able to convene in person by then. But obviously, keep an eye out, and we will have lots of updates as things move forward and we understand what's going to happen a little more. Okay, well, thank you so much for listening, and we appreciate your time. Let's definitely open it up for questions. So if you have questions, you can chat them in the chat function on the webinar, or as I mentioned earlier, you can email them to Sarah, SARAH, @FCAA.org. And I think we have some questions that have come in already. Is that right, Sarah?
We sure do. I'm super excited and proud of you all for not being a super quiet crowd, so thank you. I might start off with a question for Arben, and we also have Con on the line as well. But the question went back to your report in talking about sort of the recommendations that you'll have for funders. Can you talk more about, do you mean if those are recommendations will be kind of grouped, or will they be going kind of specifically to whether it's an individual, country donor, multilateral, or private funder?
Yeah, thanks. I think we'll have recommendations by funder potentially, depending on the final findings. Sorry, but also for civil society and key populations networks on how they can advocate basically for addressing some of the issues, what tools need to be put in place, and what kind of support needs to be put in place in the country, at the country level, to support budget advocacy, budget tracking, and these kind of stuff. I think I don't want to preempt here the exact, scope and content of the recommendations. I think this is something that will and should be decided within the community advisory panel that we are currently trying to formalize. There will be, and I think it links to another question about how the findings will be disseminated and how we make sure that these will be utilized by the key populations networks themselves. But I think, yeah, as I said, the ambition is to put together that community advisory panel that would involve community representatives who are sitting in the governance structures of the different institutions that we have analyzed. I'm thinking, for instance, of the Global Fund Board, the Global Fund Committees, the PEPFAR Scientific Committee, etc., but also our partners at the country level, and in programs such as PITCH, Bridging the Gaps, and the Robert Carr Fund, where I think, most of the key populations networks are in a way or another represented through different in different forms through membership-based organizations. So the call should be out very soon. We are hoping to have a panel that would comprise a maximum of 10 community representatives representing all that diversity in terms of key populations, regions, countries, global level, etc.
Great, thank you. There's also a question in terms of for the report, will you, maybe you already answered this, but so how the results will be and research will be available to and accessible, importantly, to key populations for them to use.
Yeah, and I was also trying to respond to that. I mean,
Yeah.
we hope that with the community advisory panel, we'll create a sense of ownership, because the final product will be decided in that format, and that basically then the members of the community panel can help disseminate and engage their member organizations around the world. And as I was saying, I mean, we'll make sure also to reach out to the different governance mechanisms so that the community representatives, for instance, in the Global Fund Board, also ensure the dissemination of the product among the networks, in addition to what we'll be doing separately as Aidsfonds, Frontline AIDS, and all the Bridging the Gaps partners to disseminate this within our existing networks.
Great, thank you. So this is kind of a question both for both sets of analyses, I think, but and kind of ties back to sort of that intersectional note that we've been talking about what it means to be an HIV funder. But do you have a sense, how does it impact the analysis that you're doing when you're looking at sort of integrated funding packages in terms of horizontal interventions or things that may kind of address multiple issues, but when it comes to key populations and CAT, maybe when it comes to sort of HIV specific funding data?
Yeah, I'm happy to start. I think that this is something that we've been thinking about a lot at FCAA, and thinking about how we can work with our methodology to accommodate these types of integrated funding packages. I think at the moment we have a methodology that allows us to track funding for multiple populations and multiple strategies at once. And so sometimes we have data that might seem a little inflated for certain populations if we do have these big integrated packages, and that's why we try and do deep dives like we're doing upcoming with the transgender funding, where we can look at total funding for transgender communities, and then because it's a much smaller pool of funding, we're able to really dive into that and say, you know, let's understand what these individual grants are really doing. And one of the things we're going to look at is how much of that funding is reaching trans-led organizations, which I know is an important question for the community, and how much of that funding is for multiple key populations, so to speak, or for, you know, specifically targeting trans communities. And I think that, you know, over time, that's something we can do with these infographics and deep dives is, you know, delve into that methodology a little bit and try and isolate some of that funding that's coming from those integrated packages, so we can really understand where the populations are being reached directly, where they're reaching trans-led organizations or other organizations that may be led in due time by the communities they're representing. So I think that's one way that we're trying to navigate that, but it's also something that we're kind of open to have conversations with other folks that are doing this type of data analysis, or folks in the community on their input. So it's a conversation we want to move forward for sure. And I think it's part of thinking about that intersectional nature of HIV funding, and how more and more we're looking at, you know, funding for sex worker communities that's not necessarily HIV specific, but really is relevant to our tracking, and we try and be inclusive in those types of grants. And so thinking about how we can isolate and still identify HIV funding, but also be inclusive of those types of intersectional grants, which I think are more and more the trend of where HIV funding is going. I hope that answers the question, but that's kind of how my brain was hearing it.
Yes, Arvin or Akana, do you want to speak to that? And I know we have about 5 minutes left, so maybe after you answer, we can have any kind of closing thoughts as well. Not sure if might have lost that connection. Let's see. Well, Kat, since we have a few more minutes, I don't know if you have anything else you'd like to share until Arvin comes back on, or?
I hear some.
I can't. It's kind of here. Sorry.
Oh,
So
wonderful.
nothing to add on that. I just wanted to add an additional point that Arvin kind of missed. So on the pitch as well, we are supporting countries around budget advocacy and tracking KP financing at the ground level as well, to inform advocacy and support. And so through that mechanism as well, we're hoping that this research will be used as a foundation, but also to find a way how we can track through gender, human rights, and community systems, looking at disaggregated data as well. So just to add that I might have missed.
This is John. Can you hear me, Kat?
Yes, we can hear you.
Great. Thanks for filling in for me, Sarah. I'm not sure what was going on with my audio previously. I was talking, but you guys couldn't hear me. So hopefully it'll stay on for just a moment longer. I just wanted to add to Sarah's comments earlier that I think it's really important for the findings of this report to really be understood in a nuanced way. Kat mentioned that we had gone back and found about 30 funders who had been leading funders who had left the field, and about $130 million had left with them. If you look at the first chart that Kat shared, it shows the 2% increase this year over last year, and it shows a relatively flat amount of money despite the exit of that $130 million. And I'm just concerned that people will misunderstand that while it looks like funds have been staying steady, that it's because that $130 million that has left from a lot of private foundation donors has been pretty much completely made up by pharmaceutical donors. And it's important to understand also that the pharmaceutical donors, in our analysis that Kat mentioned earlier, that some of the largest segments of giving by pharmaceutical companies is for continuing medical education as well as for patient assistance. That means that while the top line numbers may be similar over the last 6 years, the loss of that $130 million for grassroots work and critical service provision is hidden in these numbers. And I just want to highlight that. And we will be doing more work to try and bring that conversation forward, because it's really important that people not be misled by these top line numbers. So I wanted to share that and thank all of our presenters, and I'll turn it back over to Pat.
Thanks, John, for jumping in. I'm glad we got to hear your voice a little bit. Sarah, any more questions, or should we wrap it up with some final thoughts?
I think we're good to wrap up.
Okay. Well, I just want to thank Arvin and Kana again for being here and taking the time to present, and for everyone who's on the line. I think, for me, it's just really useful to hear that outside perspective on how the data is used, because I think it helps funders who are taking the time and energy to fill out our template and submit data to really understand the value of it outside of, we're not doing this to just put out a report and some fancy graphics every year, but we really want to have an extended impact in a larger way. And the transparency and the clarity with which we receive that data contributes to the transparency and clarity with which we can support efforts like what Aidsfonds is doing to really understand how much funding is reaching key populations and where those gaps are. And that inevitably is going to help philanthropy better place their funds in the same way that we're trying to do so with our report here. And I will just clarify that none of the data that we gave them connected funder names or grantee names in any way. It was just as we get totals for key populations and geographic location. But I do think that that's my kind of takeaway is the value in really taking the time that you all take to submit to us is really important, and we really appreciate it. And there is an extended impact from that that's going to benefit the community in a larger way, I hope. So Arben or Kana, if you have any closing thoughts, I welcome you to share them, and then we'll be sure to let everyone go.
Nothing from me. I'll let Arben, but thank you very much, everyone. Thank you for letting us speak on this report.
Great. Okay. Well, thanks everyone, and we're just a minute over, and so we'll wrap it up. But we will, the slides are available on our website, and we will send a follow-up email with them as well. And if you have any questions that didn't get answered, please feel free to reach out to Sarah, and we will we'll be sure to try and get those answered by panelists and get back to you in due time. But thanks everyone. Have a wonderful day.
Thank you, and thank you, Zoom.